Thank you very much. Pretty nice digs that these guys. I've mentioned that they must be billing Medtronic a lot because they've got nice places. I was told they were by David Lillehog, who's somewhere in the room. Look, I'm very happy to be here. I'm a nice Catholic kid from Indiana, but my wife can attest that I've been begging her to convert and move to Israel for years now. Seriously, I don't know. I travel maybe around 250,000 miles a year from Medtronic. For those of you who don't know me, I have what I happen to think is the most interesting job at Medtronic by far, but perhaps the most interesting job that a physician could ever have wanted to have. I came here from a medical school where I was working because I thought I could do most good by doing research and hopefully helping more patients than I could by putting my hands on them. But when I realized I could come to Medtronic and impact 7 or 8 million lives a year, I thought that's really where I ought to be. The job that I have is to sort technology for the company. Most people in the room probably know what Medtronic's up to. It's a very diverse medical technology company. We operate in 120 countries. It's an interesting opportunity. We spend close to $1.6 billion on R&D a year. Dale Wallstrom's here. A lot of that money is development money, but a lot of it's research. And my job is to try to influence the trajectory of the company long term in terms of how we spend money internally and what we do to acquire things on the outside. In order to influence what we do internally, I have to travel, and so I go all over the world. I visit all sorts of companies, big companies like IBM, Cisco Systems, Texas Instruments. I was just in Tokyo talking to Docomo, their broadband carriers. I visit very small companies, 3-man companies in Israel. I visit technical universities around the world, from Stanford, MIT, to the Technion, to Karolinska. And I try to sort of figure out what is going on in the world of technology that's relevant to medicine. So it's not just go find cool technology. It's technology that actually makes sense in a medical application way, and then come back and ask simple questions of the people I work with. Questions like, should we be doing this at all? Why aren't we doing this? Couldn't we spend money here instead of there? We've missed the boat here, we should buy that. So at some level, I serve as the court jester for the executive committee, trying to challenge the status quo of what we do and to try to help promote long-term investment for the company. The company, as some of you may know, has been around 62 years. We intend to be around for a few more decades, and so we have to sort of figure out, on the basis of about $17 billion a year in revenue, how we continue to grow this company double digit. Now, if we run out of things to talk about, I'll explain what's going on with the stock later. But I am here tonight to talk about Israel. In the context of all this wandering around that I do, there's no place that I'd rather go than Israel. I'm about to make my 4th trip there this year. I've been there a lot. And I go there for lots of reasons. And those of you who love Israel know that there's reason to be there if you have no interest in technology. And we could talk about that, but I think there's no reason for me to tell you why to go to Israel. Most of you have been there. I think it's the most vital place on earth. It's from geography to history to confluence of religions to conflicts of politics to the spirit of the people who are there to the bread, the food, you name it. You could say Diana after any one of those. It's enough. And so I love the place, but I really like the technology there. So we have a new CEO at Medtronic. Some of you may know he's from Bangladesh via Pakistan and England. He's been to Israel a lot, but I'm taking him back there in about a week or two. And we go a lot of places in the world together already, but I said, look, we're going to make a technology trip to Israel because I want to show you some interesting things that are going on there. And so what I'd like to do tonight is share with you some of the sort of my observations about medical technology development in general. I'll say a little bit about some other technology there, but really sort of the things that are going on in Israel that I think at some level are truly unique, different from any place in the world, and why I have a lot of hope for the country. And I also think it's a place where I am really aggressively working to have Medtronic have a larger footprint than we already have. Now, so let me sort of launch into that. I'll try not to go more than maybe 20 minutes because I think you have a pretty interesting panel. And again, I'd be happy later to answer any questions you may have about this. You know, at some level for me to come to the Israeli Chamber of Commerce and talk about Israel seemed a little silly to me at some level because I know there's people in this audience who could give this talk better than I can. When I was first asked to do this, I thought, why me? Talking to Israeli interested people about what's going on in Israel, they'll know more. I felt a little bit, some of you may know the story of the elephant that was trotted out into Carnegie Hall to play the piano, and he says to himself, what am I doing here? I'm not a pianist, I'm a flautist. This is a variant of this joke. For those who can't see in the back of the room, this is a tuskless elephant who's saying, I think some of these keys are starting to look recognizable. But let me try to explain why Medtronic is so interested in Israel and the technologies there, and put it into a context of other things going on in Israel. I suspect most of you have read Startup Nation. If you haven't, I encourage you to do it. A lot of the explanations are found there for why this is such a vibrant nexus for technology development. Most of you, I'm sure, are aware of some of the sort of seminal technology developments that are iconic, really, in Israel. Things like cell phones, flash drives, instant messaging comes out of ICQ software. Some of the best pharmaceutical stuff in the world is coming out of Israel, and by far the most important treatment for multiple sclerosis came from Teva Pharmaceuticals. It's a copolymer. And these are things that I think most of you know. I think everyone knows that Intel made the Centrino chip there and Pentium chip, and these things I think are well known. Most of you probably know this, but these are some of the companies that have significant R&D presence. And I'm sorry if you can't see this in the back of the room, but just think of any important company in the world, and it's up here. Huge operations there for people like Google, Motorola, Genzyme, Intel, Cisco. Because what are all these people doing in Israel? Country the size of New Jersey. But if you go to New Jersey, you don't find all these people. And it's not because it's compact. There's a very good reason for this. There's uncommon people there doing uncommon work in technology. And I'm going to talk tonight a little bit about medical technology. So let's on this image, again in the back of the room, these are 5 cities that I happen to think are the major clusters for medical device development in the world. By far and away, the Twin Cities and the San Francisco Peninsula lead this, and there's reasons for it. I'll show you what they are. Boston is distant behind, but a player, San Diego, is even further distant behind. Remember, San Diego and Boston, massive centers for biotechnology, but not for devices. But still, I think they would fall beneath the rubric of medical device clusters. And then there's actually a pretty interesting device cluster in the Swiss watchmaking valley, and it's related to the Swiss watchmakers who make precision instruments at a small scale. These are really the major device clusters in the world, and I think the next important one will be in Israel. Now, if you ask the question, what are the elements that bring these cities together? Why are they device clusters? I've listed in this simple Venn diagram. What I happen to think are the 4 crucial elements to seeing a device cluster happen. First of all, you need, most importantly, an infrastructure of workers who know bioengineering. That's not so hard to find. You can find that in lots of places. So you need engineers, people who know how to make things. You need talent. And that talent, again, could come from universities. It could come from other companies. In the case of the Twin Cities, I think most of the talent is 3 degrees separated from Medtronic. I think if you just go through any of the companies, you will find that some connection back to Medtronic, and this has been self-perpetuating. You find this in the Bay Area as well. You find it in Boston. You need management, for sure, to manage these little device companies that are coming up. And again, this is self-perpetuating. Again, people leave places like Boston Scientific or Medtronic, and they go and start their own companies, or they leave head of marketing and go run a small company. And so this management thing, again, I know the people here from Wharton and Harvard like to think that it was sort of an immaculate conception that occurred in Philadelphia or Boston, but in fact, most of this management's done on the job and learned on the job. Importantly, you need risk capital. And so you can go to some areas of the world and ask, why isn't there a device community in France? Why isn't there a device community in Germany? And you could find a lot of places where you think, gee, they have a lot of engineering talent and management talent, but what they don't have is risk capital. It's actually missing in action. In Europe, for the most part, there's a handful of venture companies in Europe, 1 or 2 that are good, really good. But for the most part, nothing like you see in America or Israel. And finally, you need culture. And so you could have all the money you want and all the engineering you want, but if you don't have a culture that is entrepreneurial, where people celebrate new ideas, it doesn't work. I mean, there's places like that. I spent a lot of time in Russia recently. There's actually risk capital in Russia right now, and there's great engineering, but they do not have a culture. Probably the best example is Japan. I don't think anyone would argue that there isn't talent in Japan. There's management talent, there's engineering, great engineering. But it's actually thought to be unworthy of a Japanese physician to be involved in commerce, so they actually don't have a culture that would sort of promote device development. So what about Israel? And what is it that I happen to think makes Israel the most logical place to see the next major device cluster? It already exists, really. I think no one would argue that there's a huge device industry. I think this could be perhaps one of the biggest device industries in the world, as big as Minneapolis or San Francisco. And again, the culture in Israel is different, as you all know, from almost any place. And I listed here, I just sort of made these up, I think they're true, what they are. And so the first thing that I like about the culture in Israel, because again, the risk capital exists in Israel, by the way. I mean, there's plenty of venture capital, and we could talk about it. Tomorrow's made a movie about it, I hear. There's actually a very good venture community in Israel. There's great technical talent. Management, I think, is probably the weakest link in that whole story. But here are some things that go on in Israel that I think are unique that make this probably the most interesting device cluster in the world. First of all, there's a sense of urgency, and I think everyone in the room understands this. This is a country that's been around as long as Medtronic, 62 years. Most people have come there from somewhere else, not everyone, but lots, and they have an urgency about them that I think everyone in the room understands, that basically drives them to get it done now, this year, not wait till next year. This is perhaps one of the most important things, is that this is the most networked community I've ever seen. And there's reasons for that. Ron Tablin, a good friend of mine, we've talked about, I mean, since everyone comes out of the military, most people know who was in and what they were doing, and so that there's actually, by the time you're 20 in Israel, you're extensively networked. There's nothing that goes on in that country that people don't know about. Actually, they know what I'm doing in Minneapolis, which is pretty surprising to me, since my wife usually has to call and find out where I am, but people know what people are doing. It's the most networked country in the world, and I think actually in terms of development, also extremely networked. I really like the diversity of Israel. And this is not a homogeneous crowd. I mean, they may share some common beliefs and in some cases a common religion, but even that I think is questionable. I mean, this is a very diverse crowd of people, and those of you who have purebred dogs know that when you breed people too much or dogs too much together, they don't get so smart. And one of the things that I like about Israel is that the gene pool there is pretty fresh. And you see not only some really smart young people, but I'm also impressed with the quality of the immigrants that have come to Israel in the last 20 years, particularly from Russia. So some of the most interesting device work I'm seeing is actually Russians working in Israeli companies who they would call themselves Israelis. But I think the diversity of what's going on in Israel is unique, and it makes this a really fecund environment for device development. These are undaunted people. Those of you who know Israel, and again, I'm looking around the room, I know a lot of you know it well, there's not a lot of fear in Israel. It always impresses me. People ask me, are you afraid to go to Israel? I say, are you kidding me? I'm surrounded by fearless people when I'm there. I don't have any sense of danger there, but this is an undaunted people. They've been through a lot, many of them, and they're not going to be intimidated by a device challenge. I think this is really unique, and I made this up. You can challenge it all you want, but I think that this is a unique aspect that I've only seen really in Israel. I see it in Japan. These people follow the Bushido code there. This is the samurai code. These people are also fearless, but they don't have the culture to do this kind of stuff. There's only a couple communities where I see this, and I think it's in spades in Israel, and it's something for all of us to admire and for some of you to be very proud of. Despite everything, this is an optimistic bunch of people. You look at a problem and these guys go, why not? They don't take no. And they actually have this incredible sense that it's all going to work out. I've seen some of the craziest ideas imaginable, and I say, are you kidding? You really think, Cliff, that that's going to work? Yeah, why not? That attitude actually is incredibly helpful. And again, I think to some degree unique to Israel. Now, again, I'm just a kid from Indiana, but I've only been to Israel maybe 7 or 8 times, but I think this is true, and I think it's behind a lot of what goes on. And finally, for those of you who read Hebrew, and for those who can't see it in the back of the room, this is chutzpah. And these people have unbelievable chutzpah in the device industry, and they come up with some ideas that are just simply outrageous, and have the chutzpah to think, we'll just do it anyway. So most medical devices are actually engineered initially by physicians. They come up with a problem. I think I can solve it. I see Israeli engineers with the most incredible chutzpah that thinks, I don't care if this doesn't make any medical sense. I just think it's a really good idea, and I'm going to try it. So you see things like, I'm not going to mention, I'll mention that there's a guy named Yoram Palti. Has anyone heard of Yoram Palti in the room? So he's a professor from the Technion, and he thought he could put a helmet on people with glioblastoma. This is a lethal malignant brain tumor. He's not a doctor. Don't try this, Cliff. And he said, you know, I sort of understand that cells divide by mitosis. They go through a mitotic spindle, and that spindle is assembled by little proteins that are polar, meaning they have charges. And so I'm going to put a helmet on these people and deliver an electromagnetic field through their skull. And I think I'm going to disrupt the mitotic spindle. Now, does that sound wild? It's really wild. You know what? It's the only thing that I've ever seen that actually has an impact on glioblastoma. It's too late for any of you to go long on his company. It's called NovoCure, but go read about it. It's huge. Chutzpah. He told me about this 10 years ago, and like so many times in my life, I said to myself, I said to him, that's a really nice idea, and I'm saying to myself, that's like the stupidest thing I've ever heard. I said that about stents. I've said about a lot of things. And no reason to short the stock. They keep me away from the operating line. But it's chutzpah, and again, these things to me are unique. And I think are the elements of the most unique device cluster that you will ever see. And again, I'm 60. By the time I'm 70, I think this will be one of the 2 biggest device sectors in the world. Why Israel? So again, I think you all know this. I mean, I'm not going to go over this because many of you know these facts better. No reason to hear from Moses when you can hear it straight from the source. But you've seen this. I mean, it has the highest. Part of this, of course, is simply the dynamics of a small denominator. But the highest density of startups per capita in the world. The most VC investments. I mean, this is 30 times greater than Europe, or 80 times greater than China per capita. And even to take out the denominator, only 7 million people. Israel invests more, the VC community invests more than the United Kingdom, France, or Germany combined. Now, I've been to the United Kingdom. Some of you may have been to London. I've been to France. I've been to Germany. Really smart people, phenomenal engineering, great talent, great management, no investment. Now, again, I'm not sure we have time, and I'm not a business professor, but there are reasons for that. But Israel's out investing in all these things. There's no excuse for not winning at this. This little graphic, all you see is that these are the medical device patents per capita. Israel leads the world. Of course, it's a small denominator, but the only one that even kind of gets close to this is the United States. So the point of these last 2 slides, and this is all the data I'm going to show you, is that there's lots of money being put at this. There's lots of invention. This place is on fire. Absolutely on fire. So, why Israel? What is it that this small country of 7 million people, granted biased towards very smart people with a very nice gene pool, why is it that they are so successful? And so what I'm going to highlight here is some sort of themes in technologies that are converging. This isn't true of Israel. This is true of the medical device world. And so I'll just list them for you. These are things that are converging into medical devices. So when people say, gee, is Medtronic finished? 62-year-old company, we're not Penn Central. We actually have a lot of runway ahead. And the reason why is that in this next decade, you will see the convergence into what look like medical devices of other technologies, not developed in the medical world necessarily, but mature enough now and small enough to be miniaturized and compartmentalized and implanted. And so I've listed 4 things here, 5 things that I think are vitally interesting in technology. And I'm not going to go into these in detail other than pointing out that, to me, the most interesting opportunity in medical devices in the next 20 years is converging information and communication technology into our devices. We have a plan at Medtronic to remotely manage patients with heart failure, diabetes, hypertension, degenerative neurological diseases. We'll do this like OnStar. And I won't go into any more detail other than we are streaming data. We are the content provider that we will send through the clouds, data storage, data analysis, call centers, so that we will call you when your blood sugar is too low. We'll call you, Cliff, when your pressure in your pulmonary circulation is too high. We'll call you, Ron, when your mother fell down and didn't get up, because she'll have a 3D accelerometer in. And this is not making it up. We're spending millions and millions of dollars to do this. It's bigger than us. IBM, Cisco, Docomo, they're all in on this story. It's going to be big. But you need actually really good information and communication technology and software to do that. Remember, keep thinking about Israel while I tell you this. This whole kind of deep miniaturization of electronics, our next pacemaker at Medtronic, which will be released in 2 or 3 years, will be the size of an antibiotic capsule. That's the whole thing. No leads, no nothing. We have in production a wafer-scale pacemaker that will be 1/10 the size of a penny, being implanted in the last 7 years. How do you do that? Well, it's all CMOS chip manufacturing. We need to power the chip. There's lots of technology, but this whole deep miniaturization of low-power microelectronics are going to change all the electronic implants that we do. And finally, the whole world of imaging and guidance. Right now, if you think about surgery, as most of you in the room know it, you probably are thinking knives and people opening some cavity in your body to do something that hopefully will be good. Now, I am a doctor, and I'm telling you that I see no excuse to be inside the body with a knife. There's just no reason to. We should be doing all the work that we can through small incisions, catheters going through the blood system. You have a blood system that goes all over your body. You should be able to get to the brain through the blood system. You can get to the kidneys through the blood system just by entering a little artery or vein. But the problem is you've got to see what you're doing. So you need guidance and imaging to do that. So just these 4 things alone are part of how we see Medtronic evolving over the next 20 years. And so then the question that you should be asking is, why Israel? And I would argue that these are some of the key technologies that we find better in Israel than any place in the world. And I'll just show you some of the stuff that people are doing. So I've left biotechnology off this. I'll come back to it. You may be wondering what this is. This is a map, electrical activation map of the inside of the atrium of the heart. These little dots are where physicians have gone in with a catheter. They can't see this catheter. Remember, they've gone through this. They're blowing holes into the conduction system with radiofrequency ablation. Now, you don't want to put that catheter twice in the same place, or the next thing you know, it's outside the heart, and then you have to say, I have to be more careful next time. It's a fiasco. So they have to map where they've been and where they've ablated, and they also have to kind of map, they're trying to find areas that have abnormal electrical activation. Now, I'm not going to teach you about this other than say that this is complicated. And this whole software imaging thing was developed in Israel about 15 years ago. It's called Biosense. It was acquired by J&J for around $600 million. So this is now a Johnson & Johnson company. It's a big console. They take it into the electrophysiology labs and do that. Now, again, you can't see this in the background. These are 2 little companies. One is MediGuide. MediGuide was just purchased by St. Jude Medical. It's another way to track catheters inside the body without being able to see them. They have little tiny rings on them that actually are triangulated by a GPS type system outside the body. This came from helicopter gunships in Israel. So some of you who may have video games, maybe you don't know this, but I spent time at the military laboratories in Israel too. All the weaponry on our helicopter gunships comes out of Israel. The pilots, as you may know, have heads-up display in their visors. And they, while they're flying the aircraft, they're actually looking for something to shoot at. And they can actually line it up. This is true. They line it up. You don't believe me. They line it up inside their visor, and then when they see it, they shoot at it. And then the guns mysteriously go right there. The reason that they do is on top of their helmet, they have little sensors. And on top of the canopy of the helicopter, they have triangulated receptors. And so these receptors in the canopy are following the pilot's head very precisely. And so whatever he or she is looking at is tracked and fired. That technology was transferred to catheters. It's the same story. We're targeting organs to try to deliver energy. Friendlier, but the same idea. So that's MediGuide. It was bought by St. Jude. Odin Medical is up in Yokohama. It's a company that we own. It's a system for tracking the brain while you're operating. It turns out when you drill a hole in your skull cliff, your brain falls away, actually. And so if you thought that you knew where you're going, you don't know anymore. And then you think, I'm going to have to be more careful because you're trying to take out a brain tumor or something and the brain's moving around. And so this is a way actually to track the brain. The point of this slide is that the Israeli military had reasons to track things. But they had enough sense and they had a culture to figure out, look, there's other things to track than nefarious activity. And so this stuff is emerged. So if you want to go one place in the world for navigation and guidance, you would go to Israel and you might visit the military, or you might visit one of 20 companies. I showed you 3. They're basically taking this navigation guidance technology out of the military and doing this. Some of you may know about this called the Pillcam. This is just an example of, I think, the best example of deep miniaturization of microelectronics. This is a pill, you can see it, that I think most of you probably know this. You swallow this thing, and it's actually a different kind of colonoscopy. And this thing travels through your GI tract. It has a little camera in it. It takes pictures and radios them out. This thing finally comes out itself. It's not a miracle. Physiology. But I don't think it's reused. So this is an example of deep miniaturization. It's a flagrant example, and I think a really good one. Here, you can't see this in the background. I'm sorry, I didn't realize we're going to have this kind of classroom. This is Ramon Medical. Some of you may have heard of this. This is actually bought by Boston Scientific. This is a little sensor. It's on the tip of this person's finger. It's a pressure sensor. It's not different, exactly, not entirely different than the pressure sensors that you have in your BMW foot. And so, in your cars, tires, and so, but these are actually put into interesting places like an aortic aneurysm that's been repaired so they can see if it leaks. So this is an example that Israel taught the world that you can deeply miniaturize pressure sensors, implant them, and actually get that information out. And so, again, there's many companies trading this down, but the technology came out of Israel. This is perhaps the most exciting technology to ever come out of Israel. Some of you may know that when you have a bad heart valve, generally what the surgeons will do is they'll saw open your chest and pull your ribs apart. They'll clamp your aorta and circulate blood around you, and then they'll open up your heart and they'll cut out the old valve and sew in a new valve, put this all back together, take you off the heart-lung machine, wire your ribs back together, and hope that you're alive. Now, usually you are, but it's a long hospital stay for anyone in this room who would have an aortic or mitral valve replacement. About 10 years ago, some surgeons in France postulated that we could actually put a valve on a stick. They'd been to the state fair. And it seemed like chutzpah. You know chutzpah? This is chutzpah. When I heard this, I said, that can't be right. Wrong again. And so the only people who had the chutzpah to do this were in Caesarea, in Israel. PVT, percutaneous valve technologies, are still there. They built it, they tested it, they launched it because they had the courage, the optimism, the diversity, Russian engineers, the chutzpah to do this. We bought a company in Israel called Ventor. Some of you may have heard of this. We paid $350 million for a company that had no revenue 4 years ago. How much revenue do they have today? 0. And so this may actually be my Waterloo, but I still think it was a good idea. And the reason that we did this was that we actually coveted not just the valve, we coveted the engineers because they were different. They had chutzpah, optimism, diverse Russians, and they were undaunted in their belief that this could be done. And so what I said to Bill Hawkins at the time was, look, we need to pay $350 million, not because we need this valve, we need these people. We don't have people like this. And so they became sort of the Trojan horse for us to some degree for sneaking up on Israel. We plan to build a large R&D center there, and it will be built around the foundation of these engineers at Ventor. Valtech is a Yossi Gross company, and for those of you who know Yossi, 600 patents. He's featured in this book extensively. There's just all the interesting percutaneous valve work in the world, for the most part, is going on in Israel because they had the chutzpah to suggest that we could put a valve on a stick. And so, by the way, what happens here? You take a really bad valve, instead of cutting it out, they just come up through the vasculature, and inside all roads lead to the heart, right? And you just go backwards in the arterial circulation. I promise you, you will all get to the heart. Now, you hope you get there safely, and when you do, you blow open this thing, and it pushes the bad valve out of the way and exposes a valve on the inside that's factory fresh. We've put 8,000 of these in patients in Europe. We're 5 years away from getting FDA approval. That's another issue that Dale will talk to you about later. This, to me, is one of the greatest Israeli device stories of all time. Again, I'm going to stop here almost imminently because I'm getting tired of listening to myself. But has anyone heard of Medtronic? Has anyone heard of Kobe and Judith Richter? So you ought to hear of Kobe and Judith Richter because I think they're the second most wealthy people in Israel, and Boston Scientific made them that way. So they're really wonderful people. For those of you who can't see them, they're down here at the bottom of the slide. Kobe actually was an Israeli pilot and has something like 19 kills. He told me it wasn't hard. So this was in the 67 war. Yom Kippur 67 war, I think. Yeah, and he took out 19 MiGs. And he has a motorcycle that goes 250 miles an hour that he rides with his son at night. I don't think this is chutzpah. I think it's Meshuggah. And he's kind of crazy. He told all his sons he would give them a motorcycle on their birthday, and they said, great. He said, you each can choose your own motorcycle. And they said, great. He says, I get to choose the birthday. And so only one of them has actually got it. But Kobe's a pretty interesting guy. And this is Medtronic. It's a 300-person company in Jerusalem. And at one point they exported they were the OEM supplier of all of Boston Scientific stands at the time when they led the world in the market. So they had trouble actually because the boxes says made in Jerusalem. They'd send this to Syria and places that didn't go over so good. But these guys made a beautiful stent. It was called the Nir stent. Nir was an Israeli pilot's son that died, and Kobe said, I'm going to name all my stents after your son. So he got Pioneer and Exponeer. And this is the Nir stent. And it was such a great stent that Boston Scientific decided that they would take Kobe's manufacturing equipment. They were worried that something would happen in Jerusalem. They thought this was not a safe place to manufacture. They said, look, something could happen in Jerusalem. We have to take your equipment and store it somewhere. And so they did, but where they stored it was Belfast, Ireland, where they decided that in a thing called Project Freedom, they were going to get free of Kobe, Richter, and Judith by knocking off Nir stents in Ireland. Now, this is cause for lawyering, Cliff. And they finally settled with the Richters for about $1.3 billion, I think, so they're very happy. And this is their Nir stent. Now, and this is an extraordinary story of people working. If you go there, which I have many times, I'm taking Omar Ishrak again in a couple of weeks. It's full of people from all over the world. There must be 10 languages being spoken here. And again, it's all of what I'm trying to tell you is unique about Israel that gives me cause to believe that this is going to be a very vibrant community. Now, I want you to look closely here. What you may see here is a mezuzah. Now, I'm pretty certain that I'm the only goy at Medtronic with mezuzah. In fact, I'm pretty certain that I'm the only person of any kind with a mezuzah at Medtronic. And if you look very closely, this is actually a Nir stent that has a scroll inside. It's been blessed. And I saw that Kobe had given one of these to Shimon Peres. So the last time I was over there, I said, Kobe, I saw you gave Shimon Peres one of these mezuzahs as a Nir stent. And he said, yeah, I did. And I said, well, where's mine? And so he produced it, and I put it up, and I'm very proud of this. So that's Norm Coleman, by the way, who's another great friend of Israel. So let me give you one last example in case you're not convinced yet that there's interesting things going on there. If it's just valve on a stick, you'd be saying Daenu, right? But it just goes on. Here's another pretty cool thing that was basically designed in Israel. So, not this thing. Has anyone ever had cardiac ultrasound, or some of you have been pregnant, you've maybe had M-mode ultrasound. You've seen the machines, they roll them in. They're big things. This is life-size. I mean, a person would be standing here looking right in the eye of this thing. This is an ultrasound machine that he sold. Now, our new CEO, Omar Ishrak, said, that can't be right. It's expensive. It's clunky. And so he went out to say, can't we just miniaturize this? You're getting beat miniaturization. And he said, in order to do that, we're going to need completely different software. And so where did he go? Of course, he went to Israel. And he'd been working for years in Israel with software engineers. And basically, these guys figured out how to make an ultrasound the size of a laptop. He says, make it smaller. And so this is what is called the V-scan. You might have seen this. If not, it's pretty cool. This is the entire ultrasound machine. There's a transducer here. It looks like a cell phone. Made in Israel. Of course, it's made in China now. But the whole technology development for the software came out of Israel. Just one last example I'm going to show you tonight of why this is so unique. So I'm going to stop here with sort of a recapitulation, if you allow me, of what it is that I was trying to tell you, other than I'm a flautist, not a pianist. There's lots of reasons that areas come together to become a device cluster, and we've talked about a little bit that what I think gives me uncommon optimism that Israel will be different is the things we talked about. This is a highly diverse bunch of people with an uncommon gene pool who have a urgency about them. Some people would view it, Ron, as impatience. Call it what you want. But I like it. When I go there, I feel this is my tribe. I would move there in a minute if I could get my lovely wife to go, but she thinks our kid won't visit us. I'm taking Omar Ishrak there in a couple weeks. I'm going to give him the full press on this thing, because my goal is to have Israel be the largest R&D center we have outside the United States, and bigger than some of them. We should just close some of the stuff we're doing here. Don't quote me on that. But it's not relevant to be doing R&D, Dale, in Minneapolis in the next 30 years. So people say, why don't you globalize? And Bill Hawkins said, well, you know, we're 47% of our revenue comes from outside the U.S. We are global. Well, last time I checked, about 95% of the world lives outside the U.S. And so shouldn't the revenue somehow mirror that at some point? And my feeling is that we have to move outside the U.S. and basically think differently, disaggregate the way we do R&D. And so I'm working on Omar. I decided to steal a line from Rabbi Hillel. And if you forgive this sort of, maybe isn't fair to a 2,000-year-old tone, but I keep saying to Omar, look, if not there, where? If not now, when are we going to do this? Because I'm running out of time. I'll be 61 this year. I have a mandatory retirement coming up in 4 years, so I'd like to get this done soon, Dale. And I want to, again, thank all of you for allowing me to come and share for a little bit of unbridled enthusiasm that I have for this remarkable place. Remarkable in so many ways. This is just one tiny way. But all of you who believe in Israel and believe that there's commerce there, I don't know any better commerce than this. Yes, you did make the Uzi machine gun and stuff, and you can make good weapons. But the ability to kind of translate this culture into useful weapons of medical care is really what I think will define the country. There's other interesting things going on, but software, the chip industry, the telecommunication industry, the nav, all that stuff that's been so vital to Israel, I think ultimately will find its apotheosis in medical devices. So Godspeed. I'm impatient too. Thanks very much.